Well, the managed repeat policy is about minimising waste. We know that nationally there's an estimated £300 million per year wasted on medicines every year, and that half of that is avoidable, at least half. And for the Vale of York, this equates to about £1 million of avoidable waste, which occurs for a variety of reasons. Over-ordering of repeat medicines is just one of those, but this policy aims to minimise that waste with a two-pronged approach, setting out the expectations from pharmacists to follow when dealing with managed repeats, and maximising the opportunities to educate patients regarding medicines waste. And crucially, it sets out a standard that we believe pharmacies should follow in order to ensure that managed repeats are dealt with appropriately and that waste is minimised. And local pharmacies have been provided with a protocol within the policy that they must follow, and the key points within it are that the pharmacy must have discussion with the patient or their representative about medicines waste every 6 months using the CCG's medicines waste leaflets. The pharmacy must have a discussion with the patient every time medication is ordered regarding which medicines are required. And items can only be ordered a maximum of 14 days in advance of a patient requiring them, allowing ample time for the GP practice to generate the repeat prescription and for the pharmacy to dispense it. And the aim would be to reduce that to 7 days once everyone's a bit more familiar with the process. Now, there's always going to be exceptions to the protocol, but these exceptions should be agreed on an individual basis between the practice, the GP practice and the pharmacy. Now, the Vale of York CTG doesn't have any contractual authority over pharmacies. I mean, their contracts are managed by NHS England, but GPs do have the right to refuse to accept managed repeats from pharmacies, although we believe that should only be considered if there's reason to suspect that the pharmacy are not operating managed repeats in a diligent manner. A GP practice can't refuse to accept managed repeats from one pharmacy and not another unless there's documented evidence relating to the particular pharmacy not doing things appropriately. And although we're often told that, we're only told anecdotally, so it's very difficult to raise those issues. However, if there is clear evidence and documentation, then we can do that. So please document all incidents and tell us if you think local pharmacies aren't playing by the expectations of this policy. They've all seen it, and it's been approved by the local pharmaceutical committee. If the GP practice suspects the pharmacy has not followed the protocol, the first breach should be resolved between the pharmacy and the GP practice ideally. But if further breaches occur, then the practice should just contact the CCG's medicines management team for advice. The medicines management team's role in this respect is to facilitate discussions between the pharmacy and the practice. And if it's felt necessary, the medicines management team will pass on the details of the incident to NHS England colleagues for them to discuss with the pharmacy, and the outcome of which may result in the practice being able to refuse to accept managed repeats from that pharmacy. Now, the CCG is going to continue to raise awareness regarding medicines waste with the public via posters, leaflets, and the media campaigns. It's in our health, and let's take care. It's our NHS. Let's take care of it, and it's in our hands. And we're looking to do further detailed projects regarding waste, and we'll communicate these plans out in due course. So thank you for watching. We hope that by adopting and following this policy will help the CCG achieve its vision of the best health and well-being for everyone in our community.